With increasing injectable drug use, IDU, now a significant issue in the country, government through the Ministry of Health and Medical Services intend to have a drug rehabilitation centre. To do so, Honourable Speaker, the Ministry will need to tread carefully in terms of ensuring that services to be provided at the Drug Rehabilitation Centre is of local context. Just to inform the members of this August House, what is drug rehabilitation? It is a multifaceted therapeutic approach aimed at aiding individuals in overcoming addiction to substances, including drugs and alcohol. This process requires multi-pronged pharmacological and non-pharmacological interventions, including spiritual components under guidance of expert professionals. To give an update on the Drug Rehabilitation Centre development, Mr. Speaker, sir, the subcommittee of the Counter-Narcotics Committee are working towards a National Counter-Narcotics Action Plan for August 2024 to July 2025. Included in this plan is the Counter-Narcotics Framework, which consists of 4 pillars, and they are harm reduction, focuses on treatment and high-risk behavior; demand reduction, which focuses on prevention and awareness; supply reduction, which focuses on law enforcement and national security; legal reform, which focuses on prosecution and drug court. The implementation of these 4 pillars involves a whole-of-government approach involving the Ministry of Women and Children, Social Protection, Ministry of Youth and Sports, Ministry of Home Affairs and Immigration, to name a few. The Drug Rehabilitation Centre comes under the harm reduction pillar, which is to be implemented by the Ministry of Health and Medical Services in the next 3 to 5 years. The aims of this pillar are to reduce substance abuse morbidity and HIV incidence from IDU by 85% over the next 5 years, to have practical, recovery-oriented treatment frameworks in place that lead a person through clinical treatment into community recovery, with provisions for anticipated relapse episodes in the medium term. We have St. Giles as the last, not the first option for treating people presenting with substance abuse disorders. We have specialist rehabilitation centres for patients with drug use disorders to begin specialized treatment and recovery programs in partnership with faith-based organizations and our CSOs. Honourable Speakers, at the moment the Ministry is utilising available resources to deal with the current drug rehabilitation cases, and at the same time we need to ascertain what services will be offered at the Drug Rehabilitation Centre should we intend to have one. Facilitate access to medical therapies where appropriate. Increase hospital-based counselling capacity at all large health facilities. Create post funding for at least 1 full-time counsellor and social worker AOD specific therapy training at each facility. Ensure screening resources are available at all hospitals, divisional and subdivisional. Provide training to nurses on drug screening and drug use assessment as needed. Develop clear protocols around drug use reporting in patient notes and when external reporting can be requested. Acquire land or building agreement which can be used as the first rehab centre. Set up a team of practitioner stakeholders, health and community sector, to plan a recovery treatment framework for rehab facility. Funding and resources for this framework can be sought in the following year. I thank you, Honourable Speaker, for the opportunity to update the August House.